Good evening, my dear friends. Myself, Dr. Joseph Casey. Today, I am going to speak regarding the spinal column. By just seeing the spinal column, you should be able to diagnose what could be the probable problem the patient is having. So, the nadi is a signal which is being exhibited by the nerves. Okay, so if at all, if your heart beats more, you feel the same beat in your pulse. If the nerve of the heart, that is T2 nerve, when it is getting compressed, the beat, the power of the heart will keep on reducing. So henceforth, you will be able to understand how the organs are working, the proper organ functioning, all the attributes goes to the nervous system. So you have studied regarding autonomic nervous system and peripheral nervous system, right? So all these are being controlled by brain, where peripheral nervous system you are able to control, that is locomotory nervous system. So where autonomic nervous system is being directly controlled over by the brain itself. Okay, but still brain has got a way to talk with the organs, that is through the spinal nerves. So the nerve which goes to the T2 will enter into the heart. The nerve which goes to kidney will enter from the T6 intervertebral foramen. The nerve which goes to uterus will go in the T12 intervertebral foramen. The nerve which goes to the locomotor system is like sciatica nerve, L3, L4, L5. So in the same way, each and every organ has its own nervous system. So henceforth, if at all, if the nervous system is getting blocked, the organ also, the function also will reduce. Henceforth, we say in Ayurveda, when the vata is being increased, we say that Kashna Kashnare Gatra Kampa Spurna Ushnakamita Nidranasha Iti Vruddho Vayu Pidayati. All these, if you are going to see, you will not get in any blood test, not in scanning, not anywhere you get all those things. These are all the symptoms, that is which is exhibited functional symptom. See, when the functional symptoms has been established, you have to understand that is the talking of the nervous system. Why that symptom has been exhibited? One thing, you should be able to understand the chakra, Shat chakra. Whenever the Shat chakra falls off, you will feel the low of depression, you feel low in the energy, vitality, each and everything. So henceforth, you feel certain things based on the nervous system itself. So the waves which you get, it's based on the triggering of the nervous system. So henceforth, whatever you feel in the nadi, that is the impulse which is being exhibited from the nervous system. Henceforth, the back spine plays a vital role in understanding what is the probable problem the patient is suffering. Even without patient telling anything, you will be able to identify, or you might tell the patient, see, this nerve is getting compressed. You might develop this problem in probably few days or few months according to your experience. So henceforth, what is the use if after getting a heart attack, telling a patient you have been had a mild attack? So before to that, if we are able to tell, just like weather forecasting, tomorrow is heavy rainfall, up till 7 days there will be yellow alert, red alert, there could be some use. Getting the point? So in the same way, we should be able to forecast the things. You should use little bit of your brain in order to analyze. Don't keep all your brain to the machines. Nowadays, what it is actually happening, if a pain comes, if anything comes, you straight away suggest for blood test, urine test, MRI, CT, what not. All the things you test. And once it happened like that, one month ago, one patient had come to me. He was telling that, sir, I have been admitted in one of the corporate hospital for 6 days. They charged me 60,000. Done all the scopies, endoscopy, colonoscopy, gastroscopy, all the scopies, MRI, CT, everything they have done, blood test. They told that you don't have any problem, you better consult a psychiatrist, and advised him to take a psychiatrist opinion. He came to me. Anyhow, the problem was resolved within a day. The thing is that we are not able to understand and diagnose the conditions in its when it is not exhibited in its fullest form. When we feel it is reached as a cancer, we will be at now it has been third stage, fourth stage. Arey Baba, in the first stage itself, you will not be able to understand why all the cancers are diagnosed in second, third, fourth stage. Why it is not understood in before to that? Are you able to find that? No, next year you are going to get, after 2 years you are going to get, after 2 months you are going to get. No, after getting only you will be able to understand that is cancer. So what is the use? So there should be one technique where you should be able to understand before it comes. So you should be able to tell him, see, you have got a suicidal tendency. If you go like this, you more probably to get suicidal attacks or thoughts. So change your way of thinking. So this is the what you are feeling now, right now. So if you are able to guide him psychologically, you will be able to open up his spiritual pathway. So you know that our way is the last end way is the moksha, that is dharma, artha, kama, moksha. So even a patient comes to us with a disease, we should tell them what are the misdeeds or the wrong things he is doing in his life, what is the wrong thoughts going in his software. So if you are able to correct it and lead him, then you will be called as Vaidyo Narayana Hari. So actually we should give assurance to them. Don't afraid. So Bite Bishcha Abhedanam Paramekam Na Vidyate. It has been told that. So we are really what we are doing, we are manipulating that, and we are telling, see, you have got something and you have to get operated or else you are going to die. Give me 5 lakhs. So this is extraction, or so we are taking the money. See, it should not be done like that. See, body has the capacity to heal any cancer, any attacks, anything, it could heal itself. If a patient is being carried by 4 people, within 10 minutes he will be able to walk without giving any medicines. Only mental assurance is more important. He should believe you. He should imagine. He should sustain that, yes, definitely doctor is going to do that. Then miracle will happen. So the thing is that why do you worry about all the medical things, telling big disease? So today one patient had come. She told that, sir, I am suffering from frozen shoulders since 5 years, not able to lift my hand at all, sir. I have heard about you and so I am here. Okay, fine. I told that it's not frozen shoulder. It's a nerve compression in T1, C7 area. At shoulder, I relate the compression. You will be right within 10 minutes. As I have told, it became. So she was really happy. Why all these days I took injections, these and everything without much relief. So now we have to change our perception of thinking. Now it's a time to utilize your brain, not the machineries. Machineries have stopped working. So it's really required only in a case of emergency, but emergency will not come daily. So use your brains, understand, examine, see the spine. Wherever there is a compression, you understand which nerve it is going to, that place, that organ, and you say that without patient telling you. Patient will be only telling only one problem, only one symptom, or maybe 5 symptoms. That's it. That are all symptoms. So whatever you are saying, that will be a sign. What you diagnose, that will be apt. So if you are not understanding the root cause, that is manas. And if you are not able to correct the manas system with Sattva Jaya Chikitsa, then how it is possible? So henceforth, treat with Sattva Jaya Chikitsa, manas, and with help of acupuncture, drone and mermum, osteopathy, kinostaping and whatever the system, chiro, okay, Tongzen, whatever the treatment you know, you do that, correct the spine and give him the correct posture of sleeping. Ask the patient to take daily oil bath, that is Abhyangam Acharet Nityam. Daily we have to apply oil and take bath. So only the required calcium will enter into our body and no need to take any calcium supplements which will create havoc rather than any usefulness in our body. So henceforth, which oil has to be taken? You have to take tilatel, that is sesame oil along with lashuna, that is garlic and methi. Boil it and keep it in the bathroom. Whenever you go to take bath, apply all over the body, take bath daily unless and until you have got fever, cough, rhinitis or menstrual cycle when it is going on, don't do that. Otherwise, each and every day, please do it. If you do that, you will be able to sustain all the types of diseases. So, prevention is better than cure. You know how to sleep, you know how to eat and you know how to maintain your health. So, acharana, that is Abhyanga has to be done every day. If you do all those things along with Sattva Vajaya Chikitsa, which have been mentioned in my video, you can just go through that. You can type Sattva Vajaya Chikitsa in my YouTube channel, Dr. Joseph Joy. So you will be able to get it, how to practice Sattva Vajaya Chikitsa, ask the patient to do that. So that will give preventive as well as curative aspect. Thank you and have a good day.